You know, I have to.
This meeting is being recorded.
I know you have to leave, and Dee will take over when you leave.
And I'll be back, okay?
Okay.
Okay. Well, good morning, everybody. I am so oh, can you hear me? Good. I'm really excited about the opportunity to on a monthly basis get together with the community and talk about issues affecting our community. And I just want to thank you. I think I've been working with Hawthorne and the Northside Coalition for a while. I'm trying to get the acronyms right, just so I do it right. But there has been so many activities that we have done together over this past 3 or 4 years that I think we all take credit for. Because I believe that the things that we're doing is making a real difference in terms of our community, and we want to continue that. And you know, just even in quick conversations like with Ms. Carter today, it's like all of a sudden we got another opportunity to be able to do some more work that's of vital importance for our community and around its health. And so that's why it's so important to have these kind of conversations, whether there's a large crowd or a small crowd. It's in our conversations that we figure out how we can work together more effectively. And so I do appreciate this platform for being able to come together. So I have a very quick, I think I have to leave, but I'll be back. But I just wanted to kind of give a quick update on what we're doing with HUMAN, if that's okay. Is that okay, Ms. Diana? Yeah, I want to give a quick update with what we're doing with HUMAN, because I think that all of this is really inclusive in our work. So we are actually getting ready to talk about the issue of polypharmaceuticals in our community. People are going to the doctor, they're getting prescriptions, and we don't know, or they don't know, how those prescriptions are interacting with each other, because we don't have interpreters. And so what we're going to be doing is we're going to be looking at this particular issue, and this might be one of the ways in which we might help to decrease the amount of opioid overdoses and substance abuse issues in our community if we are bringing people, giving them information that will help them to make a more informed decisions. And so we've been working on this. We actually have a plan in place where we will be doing this along with you all around this issue, just so you know that. So that definitely is in place. We also are going to be talking about medical adherence. People they have these prescriptions, but that doesn't necessarily mean that they're taking the prescription in a way in which they're supposed to be doing them. And so we need to be having some conversations. So Dr. D, this is something that we'll talk about a little bit later, just so you know that. But these are things that are already in play and in place, and we will be asking for your participation. We'll be asking for your comments. I mean, because we're not going to do this by ourselves. This is a community type work, and so but it's in play right now. And so I want you to know that it's coming out of this group as well, just so you know that it's coming out of this group as well. So, and then November the 11th, I just wanted to say this real quick. November the 11th, we're going to have an event over at the YMCA Veterans event. We're going to be recognizing veterans, both male and female, in our community with a lunch. And we also will be providing them with some information about health resources for families, because, as you know, if you take a look at the homelessness in our communities, many of those are veterans. Okay, many of them their families are struggling and suffering. Okay, so we're going to come together and we're going to be talking about, we're going to feed them. At the same time, we're going to provide them with some resources about how they might be able to address potential substance abuse issues and how families can get help. Does that make sense to you all?
Which location?
It's gonna be the Broadway Y. Broadway Y. Right. So that's we've already confirmed that. So November 11th, it's gonna be RSVP. But we want to make sure that we take care of the various people in our community that might be struggling with the issues that we're trying to address. And we just got to try some new and different kind of ways of making it happen. Okay. The other thing that we're going to be doing, which is going to be really exciting, is going to be November the 17th over at the at Life Source, which is in the Hawthorne area, I think. Yes, it's a part of the Hawthorne area. We're going to be having a men's health event. It's going to be nice. It's going to be nice. I'm just going to tell you, it's going to be nice. You don't want to miss this one. Okay. And what we're doing is we're taking 6 men from our community, and we're making portraits of them. We're having a artist draw a portrait of them, and we're talking about their health journey, and where it is about small changes make a difference in your life. Okay. And what does that mean? Is that some of the men that we're going to be showing some things happen in their life that if they could have changed them, it would have made their lives better. Okay. So for example, we had Kevin Jenkins. Y'all know Kevin Jenkins? Kevin Jenkins was the Mountain Dew and Cheetos man, right? And as a result of that, he needed a kidney. We have Willie Dominguez, who many of you know. He was one of the state representatives for this community, and he's going to be there. So I got Fred Evans. I don't know if you know Fred Evans. We got all these people, all these men who from our community who have a health journey. Some of it might be around substances, but I just saying. So we as a community, we're just celebrating them and just saying that small changes can make a big difference. And I think the last thing that we do is we'll have a portrait of a guy whose name is Chuck Taylor, who, because of the way he drank Kool-Aid and he drank sodas, not only did he catch diabetes, but he lost his sight and now he needs a kidney. So we're going to be talking about that. But as a result of that particular experience in his life, he is actually now promoting water. It's just water. And so we've been actually passing out water to our community to just say, like, instead of pop, why don't you just drink some water? So these are things that are coming out of this work, and I just want you to be aware of it. And I know, Dr. D, we have some other things that are happening, but at this particular point, I just wanted to make you aware that we're not standing still, and that you are totally involved and will be totally invited into everything that we do. So, but you got to talk to Ms. Diana, because she's the head. All right, with that, I gotta go. Ms. D, I'm gonna turn it over to you. Okay.
D, we got Patricia and Angela up next.
Okay, welcome Patricia and Angela. If you could just go ahead and share your information with us.
There we go. Can you give me an opportunity to share? I'll share something shortly. My name is Angela Reed, Chief Operating Officer of Turning Point. My actual first field of study is Human Development and Family Studies. I'm actually born and raised in Minneapolis. I went to Hall and I went to Bethune. So I kind of had, sort of a firsthand experience of the impact of inequities and disparities when I had to switch school districts in high school with middle school, and really kind of crashed hard because I wasn't really prepared. And so kind of pushed through that and kept going and pushing for what I needed. And I've kind of turned that around into a way to help the community. So I'm kind of want this to be a conversation to answer any questions that you might have and see, where it goes, what subjects you want to speak about. And then we'll talk a little bit about some of the importance of, culture and, what we can really do to try to impact what's going on with our community now. So I'll, turn it over to Patricia and have her introduce herself, and then we can kind of start off with any initial thoughts that you guys have.
Before you do that, Patricia, Al is going to join us, so he may jump in and ask you about some questions, okay?
Sounds good. Hello, everybody. My name is Patricia Carter. I'm the manager over here at Turning Point for the Culturally Specific Service Center. And I am just grateful to be here today. the topics, all these topics that we're going to discuss, they're really relevant. And I definitely, I'm a Northsider and born and raised in Minnesota. So these topics have affected me in a great way before I came into recovery. And so I am just so anxious just to dive in and talk about it, because the struggle is real. And yeah, just grateful to be here. Grateful to see everybody's faces.
All right, so let me see. So do you guys have any initial questions or subjects you definitely know you want to speak about, and I can include that in, our conversation?
Well, I think we'll save the questions till Al jump on, but I did want you ladies to touch on about the opiate epidemic in our community.
Well, what I'm going to start off with is kind of just laying the foundation and why everything in the way that we're doing stuff is, vital to how it needs to, get done. The opioid epidemic, number one, it's been impacting the African American community for quite some time. It started back when the Vietnam War ended, and a lot of, our veterans came home with addiction. And so as, time went by, the reason why our community was really able to get through that first epidemic is because it was a sort of thing that was hidden in the families. When the men came home, the women had been used to taking care of the homes. So they took care of the families. We had mom, we had grandma, and so we kind of kept that addiction hidden. As time went by, we have the epidemic with crack cocaine, and the difference why it devastated our community so much is because it impacted the women. All right. So the ones who were taking care of the family had the kids taking care of the family. And now here we are 20 years later with the opioid epidemic that's really probably impacting 3 generations of people in a home. And we have the youth really kind of engaged and have been growing up in an environment that we really don't recognize. And so this, the opioid epidemic is something that really needs to be approached in a different kind of way, because there's such a deep impact. And the fact that our community really is dealing with a lot of different struggles, it's way beyond more than just being sober. One thing people really need to understand is how to take the weight off of themselves for being involved in addiction. They have to give away that condemnation that people often get, and a lot of times that we give. I mean, there is a stigma with people who are in recovery, and we have to understand that. And then we have to really understand also that a person who is a user needs to understand that, number one, opioids are the most addictive drug in the world. Heroin is the most addictive drug in the world. It is completely hard to get off of. And we have to talk a lot about medication-assisted treatment and the stigma associated with that. One thing I know that has been really vital to the people that we serve is that, because we all know, African Americans do not necessarily trust the medical field, and that's okay. But one key thing that I have found that's helped people is letting people know, if you want to get on medication-assisted treatment, methadone, Suboxone, you don't have to be on it forever if that's not your correct recovery pathway. I met someone who was on methadone and said that they will definitely be on it for the rest of their life, because within their journey, they had overdosed 17 times. So we have to really understand that addiction is something that is very individualized, and that now, because addiction and drug use is so glamorized, that we have to really have a seriously collective approach to kind of deal with this. And it has to include prevention, harm reduction, education, Narcan distribution, and also just some recovery support where people give people a community they can connect with after they decide to get sober. And so as everybody really needs to kind of develop their own sort of personal platform on how they want to deal with addiction, because one way or another, I'm sure we're all impacted by this, whether it's with our family, our friends. Addiction does make an impact on us. And so us at Turning Point, we are defined as a culturally specific provider, and we really function by 3 key concepts, which are awareness to action, improving impacting factors, and collective impact. So really this group right here, we're functioning as a collective impact model. We're united with one purpose, one goal, all different skills, all different knowledge, with one focus to try to see if we can make community change. Awareness to action is just an idea of whatever you come aware of, you may have an action to go behind it. As simply as, if you know a family member or a friend is hungry, can we get them some food? A lot of stuff like this are the things that are impacting culture-specific providers and most providers who need to provide some sort of service outside of what they normally do, including the school system. There is a lot of steps that it takes to actually do treatment or prevention in the schools. So what can we do to increase that? And also improving impacting factors. Us as a culturally specific organization really understand what is impacting our community. And we have to understand what is impacting these youth. And the fact that they don't have access to youth activities at no cost. There's a lack of access to places even to go that are safe. And, there is also an increase in youth homelessness. What do we do to really improve those impacting factors? Just like even the single, a mother or a parent or a family who might use a little bit more at the end of the month because that is when the food stamps are out or when they're worried about rent. What can we really do to improve those impacting factors? And that's why it leads to the collective impact too. Some of these issues have to be done collectively, and us as a community to understand the priority of it, whether it is acknowledged on a wide scale or not. And so I think some of the biggest factors right now, at least with opiates, are the access. It's cheaper than other drugs. It's easier to hide than other drugs. It's easier to get. But what makes it scary, and this a little bit different, is that it has a high mortality rate. Back in the day when people who were in addiction, if they ended up overdosing, it's usually someone who had been using for a significant period of time. With this, someone can overdose the first time they try. So youth they need to really understand that experimenting, which is just part of their phase of development. They think they're invincible during a certain age, and that's just, kind of how it is, that this can kill you the first time. And then us as providers, especially if we are, community healers and community advocates, it's important to understand that even though we might want to intervene in some things, so, if we walk into a room and maybe see our child using, the first thing we're going to want to do is grab that package and throw it away or say, what is this? But it can be absorbed through your fingers. And it's 100 times more potent than morphine. So you could pick up a bag just trying to throw it away even off the street to clean up your community, and you can end up overdosing and dying. So, as we go through that, like I say, I'm a staunch advocate for, Narcan. That is an injection that can be done through a shot or through a nasal spray. It's really one of the most widespread, highly effective tools that we have. The one thing that convinced me, because I was nervous about Narcan, like, I'm not going to be doused to nobody. That is not for me. Is that, if a person isn't overdosing on an opioid, it's not going to affect them negatively. It really connects to the receptors of the brain that are impacted by an opioid overdose. And I think it's also important for people to understand that there is a such thing now called Steve's Law, which means if you are in an environment and someone happens to overdose and you take them to the hospital or you call the ambulance, that you will not be charged with a criminal offense. And that was something that took a long time to pass. But people need to know. I mean, we're talking now about saving lives. We're not talking about abstinence. And that we need to really keep that in mind and focus a lot on the community. I think Patricia
I think she froze up.
Can you hear me?
We can hear you. I think Angela froze up.
Oh, yeah, she froze.
We'll let you guys go a few more minutes and then we'll hold questions till the end and bring in our next presenter.
Okay, thank you. So I just want to ask a question of our people today online. How many people know someone or know someone that knows someone who is addicted to fentanyl, heroin, any type of opioids? Because I know quite a few people, and I know people that know people, family members who are affected by fentanyl use. It's becoming widespread.
I'm back.
You back. You froze
You
up.
froze and then I got kicked out.
So I had just asked the question, how many people know someone or know someone that knows someone who is addicted to fentanyl? Someone who overdosed. And we have quite a few people, and it's affecting us all. It really is, in some form of a way. So go ahead, Angela, finish up.
Well, I was kind of going to ask some of the same things. I know I'm kind of a lecturer at times, and love having everybody on here, but I also wanted to so if you're good with me to just keep on flowing through, I'll keep on doing that.
Well, we have another presenter, so if you guys have any questions for Patricia or Angela, could you put them in the chat? Then we'll go to our next presenter, and then we'll come back for questions if that's okay. Nobody's saying anything, so is that okay with you, Angela and Patricia?
Absolutely. I'm eager to hear too. Hi, Latrice.
Okay,
Yeah.
So with that being said, I thought Dee was going to jump in there. With that being said, we'll have Kim go, and then we'll come back, you guys, and do questions. If you have any questions, put them in the chat. I'll try to read them all, but we'll have time for Q&A, so this way we give both presenters a chance to present.
Hello. Oh, here I am. Well, my name is Hanmin. It's the easiest way I tell people is it's Han from Han Solo in Star Wars. And Min is like, you're a mean person, Min. That's how I introduce people about my name. Yep. And thank you for letting me come here and participate and share about our clinic, Broadway Family Medicine, and our services and resources here. I'm going to share my screen so everyone can look at them together. Oops. Can you guys see them okay? Okay, perfect. Again, my name is Hanmin. I am one of the social workers in Broadway Family Medicine, and I mainly work with substance use patients in our clinic. Thank you for Angela for all the information about opioid, which helps me cover a lot about our services here. So a lot of you guys probably happen to notice we are in North Minneapolis, located on Broadway Family Medicine, Broadway Avenue. That's our clinic contact information, just in case if anyone needs them for reference. And we are a residency clinic who we are training resident doctors for fully functioning doctors in the future with full license. And I came to talk about substance use treatment and those resources that we have in our clinic. But one thing that our medical director wanted me to make sure to share is we are a primary care clinic, not an addiction clinic, where we provide and take care of individuals from birth to death, from young children, infant, young adult, and older adults. And the reason that it is important to talk about substance use in primary care clinic is where it reduces some stigma for people to get treatment, as patients are maybe waiting in the front desk to get treatment for their addiction. Nobody knows why they are coming to our clinic. So it gives some privacy for patients to receive care in some of comfortable situation where nobody knows why they are coming for our clinic, right? And we have a specific day set aside Wednesday afternoon just for MAT initiation. So if patients are coming for we treat all addiction, including alcohol, opioid, methamphetamine, heroin, or some people come with methadone addiction, find methadone from streets, or cocaine. And our providers will sit down, and the Wednesday afternoons are specifically set aside for comprehensive evaluation, and we'll be introduced with all the services and support that is available in our clinic for substance use patients. And for those who are getting our substance use treatment will be people who are older than 16 or older, and unnecessary part of our clinic is that patients are expected to pay coverage through insurance or self-pay. But if there is any situation that they are in our clinic and need support for resources for payment, then I'm here in clinic when patients are enrolling, initiation for Suboxone, for any MAT support, then I'm present to support patients for navigating systems and situations. And if anyone needs flyer for all the information that I discussed, I have my contact information at the end of presentation for people to reach out to me. I can mail them or drop them off or send PDF file. So one of the things that we do in our clinic is also researching to learn and also provide better support for patients. And one thing that we learned is how does treatment success looks like for patients. So these are some qualitative information from our providers and patients. And the first success treatment look like staying sober. So Suboxone has helped patients to maintain sobriety and reduce risk of overdose. And another one is taking steps to improve physical and mental health well-being. The reason that we are treating substance use in our clinic is addiction does not impact health. It also impacts all function in all areas of life. And one thing that our patient mentioned is, well, having just a primary doctor is a big one. I have gotten everything like health-wise, not just Suboxone part under control. And another thing is improve psychological well-being. And our providers mentioned normal looks different for everyone. But this person stated that he heard a lot of, I feel normal, which is a success. And a patient in our clinic mentioned, I mean, it just changed my life, I guess I could say, definitely helped improve my quality of life. And successful treatment also looks like improved relationship and repairing the relationship that probably got hurt during during substance use. And another part is improved role functioning. And another thing is shift identity and decrease of shame. And the main reason that I reached out to Diana Hawkins, thank you, Diana, was to talk about fentanyl test kits. In the community, fentanyl has been more widespread than we want it to be. Now people are buying, are probably not there thinking that they are paying for. They have been well spread without people knowing, and the risk of overdose and risk of death is really high with fentanyl. And the way that they if combined with our brain and opioid receptor looks much stronger than other opioid type of medication. So we created these test kits that we usually give out to our patients in clinic if they are enrolling Suboxone in our clinic, or patients discussing concerns about substance use for themselves or their loved ones, friends, or people in the community or family members. They have 2 fentanyl test strips and water bottle for them to help test the substance that they are using. And we have a resource flyer that we have the first page picture included here. It has a very self-explanatory about how to use test strips, and on the back it has harm reduction resources on the back and has some care items. We are replacing sunscreen for lotions for the winter for help people to stay moisturized in dry Minnesota winter. And I have been collaborating for a couple agencies in the community to send these kits so that they can distribute for people that they are working with. So if you guys have places or organization that you want to distribute them, you can send me an email, which is the best way to contact me. But I still put my direct number in there. My phone is not working properly. So if you call me, we'll go straight to voicemail, but I will give you a call back as soon as I can. So if you have any interest about collaborating with us just to get more test strips out for those who you are caring about, then just contact me and we will get together and collaborate and get them out there in the community. That's all I wanted to share and say. If you guys have any questions or things that you want to ask, I'm here.
So why don't we do this? I want to go back to Angela and Patricia, because I saw a couple questions in the chat for them. One was from Rachel. So if Rachel wants to ask her question, please do so.
Gosh, anything to make you to not have to talk, Diana. It sounds like it hurts a little.
I'm good. It sounds worse than it is.
Okay, make sure you are gurgling and get some rest on those vocal cords. I just was wondering if you all think that there's a disproportionate response in the African American community because of the prescription rates in response to sports injuries, right? So it's a common theme that I've seen along many opiate users or former opiate users predominantly stories is that they started because of an injury, right? I had a back injury, I had a sports injury. And do you think that that is, creating this kind of disproportionate response? Because like you said, Angela, sometimes we don't have very many activities, and one of the few subsidized activities that we really kind of can get is sports. And so then, is that creating more of a problem? I mean, do we need to target sports medicine in any way?
I mean, I would say it's a combination of things. And I think even the ideas that we think of when we hear disproportionate response in the subject areas that kind of come to mind at first, you think of awareness and maybe, but we have to, when we think about the response, we have to think about the various areas that are disproportionate, which is number one, it was a little bit delayed. We could have had, our opioid response dealt with on the forefront some time ago. Mm-hmm. And then also there's a disproportionate response to really understanding some of the root causes. So one thing that's a little bit different, sports medicine and the issues with, overprescribing are very important. But within the African American community, the source is not necessarily overprescribing. Oddly enough, it's a little bit have to do with underprescribing. So there's a huge stigma in the field that, is being developed over the medical field for the last 20, 30 years, where people who are in pain, African Americans, are often overlooked and not prescribed an opioid where it might be the most appropriate procedure, but it needs to be, we don't need to get 30, 60 pills, but we do need something for our pain. And that often has it being overlooked. So number one, you end up having a physical pain, and then you end up having a psychological pain from not being heard. All right. And so there's definitely not a huge focus factor on the opioid epidemic. With this COVID stuff, I have to consciously remember if we're talking about pandemic, epidemic, all these endemics. But we have to really understand that we are underprescribed, which often leads us to stuff. And then we are also undiagnosed with mental health. And so, you know, when it comes to disproportionate rates, there's definitely a disproportionate approach, and that I think some of the needs are not, you know, overall recognized. And that also in general, it needs to be completely more widespread. You know, this is one of those things where it can be segmented by race, but it's also a little bit more beyond race and beyond color, where it just needs to be one massive public awareness campaign going across the board. And we just have to understand that some things will cost money, but some things will just take manpower to do it. And so I think when it comes to kind of disproportionate weight, I see a real difference in the response. Within African Americans, it's often criminalized. It's often treated as if people are delinquents, rather than really trying to get to the underlying problem of where it comes from. So yes, a proportionate of our people do get addicted to opioids from overprescribing, but that's not really necessarily a majority of the case. And it's not going to be the same for each generation of person that we're dealing with. And I think that that's a little bit of the difference. A lot of, you know, I think that's a little bit of the difference. And a lot of families that are not of color don't have to deal with the impact of this generationally, or it's more secret.
My friend, Miss Lynn Crockett, I know she has some good points that she wants making in the chat. Where is she at? Is she still on?
I'm right here,
All right.
just typing away.
We
That's,
want you.
that stuff I see on Broadway, honest and truthfully, it breaks my heart. I have all I to do to not cry, because at the beginning of the school this year, my great grandson is a polar now and playing for North High football. And after practice every day, he wants McDonald's. I'm not going to Robbinsdale. So we go over to McDonald's. And every time I see these young people over here congregating or digging through trash or finding a secret place to sit, and you're not hiding it all, you're right where we can see you, and then throwing something over their head. But some of them backpacks they had on didn't contain worldly possessions. They look like brand new school backpacks. And my fear is that some of those kids are in our building. So I have really been fighting with Minneapolis Public Schools and taking the park board and the county commissioner to task about Narcan availability. Because when I asked if we had it at North, they told me no. And then I was told they needed permission. And I was trying to figure out why we need permission to save a life. And honestly, I have a grandson who overdosed this summer. And it just so happened that where he was, they had Narcan. And the police said, had the Narcan not been there, he would have been dead before the police arrived, because he was already turning blue. So we don't even have any wiggle room on call 911, because who knows when they're coming. You won't be a priority. So I'm trying to get it in our buildings. I'm trying to get it in our parks. I'm trying to make them. I just like to be safe, not sorry. If you don't need it, oh well. But if we need it and we have it and we can do it, the county will train for free, you know. So it breaks my heart. But then I also realize they have mental health conditions. And I know for a fact, myself, when I have concerns about me, I'm not really ready to talk about it, because I'm worried people will see it as a sign of weakness instead of a sign of being overburdened with caring about too damn many people. But at North Point, that first door on the inside, I said, that is just the biggest mistake you ever made. Because when people come in and hit that corner and go in that door, everybody knows why. I tried to get UROC to do a mental health fair, where we just brought people who do mental health services to the table, you know, to just provide information. And it was such a stigma that they didn't think we should do it.
Oh,
they didn't think, like, come on, the resources are here. We put you don't have to, you're coming for a family member, a friend. It doesn't have to be you, but we won't even work on removing the stigma ourselves. So I personally am very sad and disheartened about this. The fact that it happened to my grandson, not once, 3 times this summer. And when we talked about it the last time I made him come live with me, he said, Grandma, I was trying to die.
wow.
So that makes that means it wasn't even an accident. I said, after the first time, how did you ever have number two? And then it was like, Grandma, I just been so depressed. I was just trying to die. So that's like, now you're intentionally doing it. It isn't just an accident. So.
Oh yeah, and there's
I
information.
have a lot to say, but I have.
Come on, I love hearing you talk. It's been a while since I've been in a meeting with you, but your passion is always there, and it's so true, you know.
Yeah. So I'm just, when I saw this on Facebook last night, I was like, oh my God, I got to be in that meeting, because I'm also me and another person I invited to this meeting. We sit on the Hennepin County Department of Community Corrections, and we've been trying to talk to the probation officers and people about how we're going to help our kids, and that we need mentors, and can we do something? Can we intervene or prevent before we have to react? So it was important that I be in this meeting to hear this, because these opioids are a big concern of mine. And since it has touched my family, and it could touch my family again, I'm very concerned about it. I believe that everybody who was born had a mother who loved them. And I'm thanking God that none of those are my babies. But if it was, I would want somebody to try to help them. So that's my take on it.
Dr. D, can I get you to weigh in on this topic? There you are.
Yeah, thank you. I've been listening. Boy. So I'll just introduce myself a little more. I'm an emergency physician. Been doing this for about 20 years now, really focused on opioids for the last couple of years. I'm appreciating everything everyone's saying. My thoughts and my learnings and kind of my dedication in my work now is around getting people on the treatment they need. And the treatment is starts with a Suboxone, with a medication. Understanding that this is a medical disease, it's a brain disease, it's not a lifestyle choice, or with the potency of the fentanyl that was being described, that reprograms the brain. So it's unfortunately within a matter of either first use or early in use, it might be kind of poor judgment at one point, but fentanyl, unlike any other substance I'm aware of, is just very unforgiving for that kind of initial wrong decision. So understanding it's a medical disease makes it easier to see that, oh, we need medication to heal from this. Some people, it might be methadone is kind of more well established and long standing, but Suboxone is a pill form that doesn't have a lot of the same drawbacks as methadone has. People say they feel normal again, rather than having the euphoria or the high that is associated with methadone. Either option is good. Either pathway is so much better and healthier than daily active use of the illicits. But I'm really trying to understand better how we can get more people on medication, which is, for me, the preference is for Suboxone as a prescriber, and someone as a public health person who's looking at all the data and talking to all the policy people. When it comes to African American community, I think awareness is a big part of the challenge. All the problems in our community can be hard to sort through. Okay, for problem A, we got to do this, that, and the other. Problem B, we can do this, that, and the other. I think for fentanyl, because it's such a time sensitive and such a major impact, we just got to get focused on raising awareness to get people on treatment. There are facilities like Broadway Family Medicine, in North Point, but then we also got that kind of historical relationship, even current relationship with the health system. So I think that trust, I don't know how exactly we resolve that trust, but I do know that without the medication, I don't think we're going to turn this thing around. When Ms. Crockett, you were talking about, I think I heard correctly that your grandson had some desperation when he's talking about his use. I wonder how much of that desperation, and I'm just thinking about the patients that I see, comes from a lack of awareness or understanding. The stigma associated with opiate use, has all types of consequences to it. So people don't necessarily want to think through something that's stigmatizing or uncomfortable or isolating or whatnot. But if you understand it's a brain disease, then okay, it's simpler to get a finger on it, right? And come up with a game plan to getting stabilized. And then it's not like a silver bullet, the Suboxone, but it's like, I keep saying it's like insulin for a diabetic. You need the medication, and then you also need the lifestyle, the exercise, the diet modification. But without that medication on board, those other things aren't going to work as well.
Well, I heard what you were saying. The one thing that confused me about what you're saying is that most people who are doing fentanyl do not have a prescription for it. So it's not being given by a doctor. So my bigger concern, my bigger anger is that there are people in our community out here selling this to our community. I'm madder about that than anything else. That Black men are selling this to Black children. So, I mean, but it's not, so you can't control what's not prescription.
Right.
You know what I'm saying?
Yes,
and how they have access to it.
And sorry if I misspoke, but the other aspect of this is, people who are trying to finance their fix are going to do it through, one of three ways: through opportunistic crime, through distribution, so they're selling it to other people, or through sexual trafficking. That's my understanding of how people can pay for an expensive habit like this.
And you see all that on Broadway.
The other beauty of the medication is, if I'm stabilized on medication, then I don't need to pay for my daily fix, right? So that also, it's not only good for me personally, and my family who cares about me, like yourself, or my community, it has public safety benefits too.
So is that like methadone is the heroin, this is the fentanyl? Is that what you're saying?
Yes, and they're all similar classes of compounds. Some are pharmaceutical and tried and true safety efficacy. So the buprenorphine, the Suboxone, and the methadone are pharmaceuticals, right? They happen to be, or they're related to heroin and now fentanyl. So when I say fentanyl, I'm just saying, opiate users, but the amount of fentanyl that's circulating now that's cut into what people might think is a counterfeit prescription medication, or they might think is heroin. Most, if not all of that stuff is fentanyl nowadays, just because it's cheaper to manufacture and to transport. You can bring it in by a shoebox load rather than a container load from, some war zone somewhere.
So isn't it terrible that our community would trust people and give them something to take more than our doctors?
Yeah, and that's part of the
seriously. I mean, there's got to be trust, because this kills. So how do you even know what you're getting?
Yeah. So Dr. D, I'd like to ask the question. I think it's 11:51. We're getting close to the end, and I want to just ask a quick question. Then, if there are any other questions that people want to ask, so we talk a lot about these issues. My question to you is, how do we define lanes for people to run so that we get to the finish line and win? So what I mean is this, is that, we see this huge problem and it just seems like it's overwhelming. How do we help people to identify what roles they can play in order to address this issue? Because otherwise, maybe I'll keep talking here, but otherwise, everybody's going to wait for the doctors or the police to do everything. And I think that there are roles that we should be able to identify in our communities that we could be playing that will help us to try to address these issues. So that's for anybody, or
I agree.
I
I
like
have
to
all
ask,
I
I
can
like
connect.
to ask Jaime, what is happening over at Broadway Clinic with this fentanyl?
Oh, I'm so sorry. My internet is not going great. Can you repeat that again? I'm so sorry. I know your throats are great, feeling great.
I was asking the question because I'm going back to what Angela and Patricia and Lynn was saying. Over at your clinic, what are you guys saying regarding this fentanyl? Are you getting people from out of the community or are they coming elsewhere?
So we have people from the community or people who are driving 2 or 3 hours away to come to our clinic for Suboxone. We do notice some people might be saying, I have been taking oxycodone, and we run urine drug screening to see where they are and then to try to build a better care for the patient. But they are not, they think they are taking oxycodone, but it ends up being a fentanyl. That's a really common case where people are buying things expecting it's something that they are paying for, but that ends up being something else as it's much cheaper for people who are selling to get the most benefit and cost effective, but yet it's killing too many people with fentanyl. So that's why we are trying to see what we in clinic can do, and my team is trying to develop fentanyl test kits for people to use with the full knowledge of what they are actually consuming, so they can prevent more harm to be done.
So Ms. Diana, we have visited the Broadway Clinic, and and have gotten some of their kits. So we're going to be figuring out how do we distribute them in the community. I think Fred Evans is going to be a part of that. So we are trying to figure out how to use, this organization to also distribute kits into the community and get into more allies. So I'll just say that I'm not giving them a plug. I'm just saying that when both Fred and I visited them, we saw a sincere desire to do something. They had a phenomenal kit that they could distribute, and so we want to make sure that we are utilizing all the services that we have in the community and making sure that people understand that help is there.
Does that kit cost money?
No.
No, so it's funded by one of the grant that we have in our clinic, and we are using that money to distribute it for free for people who are in need.
So Angie, what are you guys seeing at Turning Point?
Well, I know, I've been at Turning Point now for 14 years, and I think the one thing that has really impacted us a lot is that now it's a lot of young people. And when someone who is older comes into addiction, they know the impacts that it's had on their life. So they're really eager to make that change. They know the negative consequences. But the problem a lot of times with youth, especially just because where they're at with development, you have to really take some time to make them understand how deadly this is for you. It's a sort of thing you really need to take seriously, because you can die and because you can't have as much control over it. You guys remember what it's like when we're young. We're going to take over the world when we're young. And so it's a real scary and delicate thing. And then plus youth really don't have an opportunity to just really talk about things that they're struggling with. I mean, you got social media that has people, glamorized so much with a false sense of pride that when it gets down to the bottom of it, they also have a false sense of condemnation. And that, you got to kind of move forward. And this is one of those things too, I think has been different this year over the last couple of years, is that it's impacted so many of our providers in terms of people that they know. So the compassion fatigue is real. We work in a field where we want to try to help people on a daily basis, but then we have people who have to go home and there's no way to really separate it. Because like I said, we drive down West Broadway too. I'm nervous every time my 19-year-old son is gone from the house. It's got such a deep impact. And plus, we have our staff carry Narcan. We keep Narcan. And we're trying to spread that awareness, and we think everybody here should have it too. It's just devastating. I mean, You really can't underestimate how devastating it is, especially with, violence. I say we're in a state of emergency. And so that's what I'm pressing for the next 2 years. This is different. We are in a state of emergency, and we have to take care of it like that.
So Patricia, when you speak of the influx of youth, would you say that influx, was that pre-pandemic or post-pandemic? Well, we're still in the pandemic. Was it pre or during the pandemic?
I have to say both.
Okay.
Yeah, both.
Thank
And
you.
it's almost like, just like what Angela said, our youth, they have this carefree, whimsical, invincible mindset, as if I can do what I want to do. And it gets them in that addiction mode faster than I think they would want to go into. So
I agree. I think that it actually started before the pandemic, because in 2019, when we had the polar vortex here, that's when the carjackings really accelerated. That's when they started it. I even asked the police, I said, is this an initiation for a gang or what? Because I mean, it's just all day, every day. And it's gone on ever since then. So this was pre-pandemic. So they already had access to something that was driving them crazy.
I just want to jump in. Apologies. Randy Washington from Freedom Works. This is more along of a strategic idea. I remember many years ago when AIDS and HIV was more of the spotlight, more of the concern for young people. An initiative was brought out where peer educators were pursued and trained, even hired high school students that were able to kind of engage and approach their peers, and even younger kids in middle school, even elementary school settings, with just educational and encouragement. I wonder if that might not be an effective strategy to be just another tool in the toolbox for us as we're looking at speaking to some of the young people that are engaged in this.
So I think
I remember we did that at North. I remember when we had peer mediators, because my granddaughter was one, and amongst things they had condoms, so they could have conversations with kids that came out of North Point. But at least kids had kids they could talk to who could direct them. So I do like that. Sorry for interrupting.
No, that's fine, Ms. Crockett. So it's 12 o'clock now. And so what I want to do is that we want to end this conversation, but I do want to tell you this, that we will be coming back to you. We're in the process right now of talking about an outreach effort to those between the ages of 12 through 19. So just so you know that, we will be utilizing this group to do that. I mean, once, I'm one of those kind of people, I don't say nothing until I got something in my hand, but I want you to know that we're not sitting still. We are doing some things. And when we have those things really solidified, then we're going to come back to this group and say, help us to direct this, to guide this, to make this thing work. And so I do appreciate the opportunity to work with all of you, but it is happening. It's just that it's taking a little bit longer. And so we want to, Ms. Reed, we want to get together with Turning Point, and you and Ms. Patricia, and we really want to sit down and have lunch and just kind of talk about what we're going to do. So, and we can work together. It'll work.
Yeah, because I got, me, I got some information I want to share. And we're trying to get this plan together, and we're looking for the community to get involved, and we'll have some research, a project that we're working on too, that's going to roll out, that really needs to take the input of providers who've been in the field and individuals working more than 15 years. We got to look at what's going on in Minnesota over the last 15, 20 years. And the impact of where we're at.
Yeah. So with that, we thank you all for being a part of this meeting. I don't know why Ms. Diana let me take over, because I'm real anal about time, but thank you. And there will be some minutes and notes and things like that coming out about this meeting. And if there are any questions that you have, don't forget to talk to Ms. Diana.
I just want to say you guys can view this taping later on Insight News this afternoon, Facebook and LinkedIn. So if you do need a recording of it, just send me an email and I'll make sure that you get it, okay? And with that, I want to thank everybody for coming. Have a great weekend.
All right, bye-bye.